Hello, my name is Tyler Ferrero, and today I'll be demonstrating the proper use of a tilt table, which is skill 14. You may want to consider the use of a tilt table for patients who have been bedridden for an extended period of time, if a patient is only able to bear weight on one limb, for patients who are suffering from orthostatic hypotension, and it's also used to test and treat for syncope. Alright, the first thing you want to do when setting up a tilt table is make sure that the patient's trunks and extremities are all in line. After that, make sure their feet are in maximal contact with the base plate. If that all looks good, you can start to check their vitals like blood pressure, heart rate, and respiratory rate. And if everything is normal, you can start strapping them in. When strapping the patient in, you should use 3 straps. The lowest one should go 3 to 4 inches above the patella to maintain knee extension. The other strap should go over the height of the iliac crest to support the pelvis. And the highest strap, will go over the chest to support the upper body. The number of straps you use is dependent on the patient's condition. If the patient has an external fixation device, leave that area unstrapped. For example, if they just had open heart surgery, don't put the upper strap over their chest because that can irritate that area. When setting up the tilt table straps, you will want to grab one of the straps, put it underneath the metal bar over here. You will raise the patient's arms. Go under each arm. And go under and over the top of the metal bar on the other side. Just grab the buckle. Comfortable? Yep. Make sure to ensure the patient's comfort after putting the strap on. Once the straps are locked in and their vitals are all normal, you can start tilting the table. Depending on the patient's condition, increase their elevation slowly. For example, a patient who has been bedridden for an extended period of time, you should increase elevation by about 10-degree increments. Halfway through the elevation, check their vitals again, and if everything is normal, continue raising the table. After elevation is complete, make sure you check patient's comfort. Notice that the table is not at a 90-degree angle because this can give the patient a feeling of falling forward. So in this position, the patient can start performing the rehabilitation activities. For example, you can loosen the lower strap to perform exercises like squats. For a patient who is on single leg weight bearing, you can place a block under that leg to elevate their injured side so it isn't on the ground supporting any weight. After the activities are completed, you can check the patient's comfort levels and check their vitals once again. If everything looks normal, you can start lowering the table. Once the table is horizontal, you can check the patient's vitals one last time. If their vitals are abnormal, you can keep them on the table until they return to their normal state. After that, you can start unstrapping the patient.
It makes it easier to bear.